This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Well, if you've ever had to spend time in the hospital being told you're being discharged, well, it's exciting, but it can be a little scary as well. You're literally going from having around-the-clock care to not having that magical button to press whenever you need help. But you're certainly not alone. Now, the two women joining us now are here to talk about the continuum of care provided to patients that not only makes that transition from hospital to home easier, but helps in health management and ultimately recovery. This is Lynn Armiger. She is the Director of Continuum of Care Services at PRMC, and Beverly White is the Delaware Branch Director for Peninsula Home Care at Nanticoke. Thank you both for being here this afternoon.
Absolutely.
And Lynn, I want to start with you. You know, I started off talking about a hospital stay, but it's not always a hospital stay that the patient needs, and that's something that you help determine, I guess?
We do. Certainly you're going to encounter emergencies that are appropriate for you to seek emergent care. However, when you go to the emergency room, oftentimes you're not admitted. You're going to be returning home to your primary care doctor. If you are admitted, we have very specific criteria, though, that Medicare, Medicaid, a lot of the insurance companies really are going to help guide that decision of where you transition to. So is it back out into the community, or is it to an inpatient stay? Also, we really encourage you to think about, is this an emergent situation, or is it something that I can seek care with my primary care provider or an urgent care setting as well?
Sure, sure. And then the same with being discharged from the hospital. That's certainly not taken lightly. What's the process?
You know, using the word discharge is really kind of even changing today. It's that we don't want to discharge you and have you feel that you are left alone. We want to transition you back to your home and to your primary care provider. So really the terminology around leaving the hospital, whether you're being discharged now but transitioning to home, or transitioning to home care at home, or transitioning to a skilled nursing facility. All of that process begins the minute you walk in the door. We're really asking you a lot of questions to understand what home is like and what your needs are going to be, but it's also asking you to know what your expectations are and what your needs are going to be if, when you live at home, you don't have support. So do we need to link you to home health so that you can have support at home? Do you actually, we ask a lot of probably what might seem unusual or prying questions, but we find for you to be able to stay safe at home after a discharge from the hospital, after transition to home, that we want to make sure you have running water. We want to make sure that you have the money to pay for the medications that maybe are new. So we may ask some uncomfortable questions around finance. Do you have support at home? Do you understand how to take your medications? And so if you have challenges around those, we're going to actually try to support you with our nursing and social work staff to get all of those services lined up before you do transition home or off to a skilled nursing facility.
Yeah, so you don't bounce back into the hospital.
Exactly.
And of course, nobody wants to go to the hospital in the first place, and there are steps we can take to prevent that from happening?
Sure. Like I said, hopefully the decision to make the visit to the ER is actually one that you've thought through of, should I call my primary care provider for this, and start with them, because what we see in the ER frequently are things like urinary tract infections, colds, sore throats. Those are really well managed by your primary care provider who knows you particularly well, and you know what you're allergic to, you know what your home situation is. But any visit, whether it be an emergency room with your primary care provider, there's some really key important things for you to understand around your insurance. What does your insurance cover? Will you be able, if you need to see a home health agency, which home health agencies does your insurance cover? How much of a copay are you going to need to be mindful of if you have to go to a skilled nursing facility? Have all of your medications ready to, you know, discuss what your current medications are.
Lynn, a lot to know when it comes from the hospital, and Bev, you're talking from the home health care side of it all, and you really do communicate with the patient long before they are sent home, don't you?
Oh, absolutely. So as Lynn said, the process to transition home begins as soon as you get at the hospital. So during that time, your physician is talking with case management to talk about what kind of services you may need at home. They are the ones in the case management department that will engage our liaisons for home care. The liaison can then go and talk with the patient and see any questions they have. We have a lot of people that have not had home care before, so it gives you the opportunity and your family to talk about some of those conversations of what to expect, what kind of services we can offer, and then that way all of that information is communicated back to the office, and they are constantly working on that information so that the day you go home, our office can give you a call and let you know that you've been scheduled for service, and the nurse is going to come out and see you the next day. So.
Do you ever get patients who just don't want the services? They just want to go home and be done with it?
We do. We have a lot of people that I think, again, don't really understand what we're able to do for them. I think sometimes they think that they're going to be okay at home, or maybe that they have family that's going to come stay with them for a few days, and then when they're gone, that situation changes. So in our office, best practice is that we call you a few days later. We call the referral source, whether it's the hospital and case management. We let your primary care physician know that you have declined services, so that when you go for your post-hospital follow-up appointment, if you aren't quite sure, or if we call you a few days later, maybe things aren't going quite so well, it is still not too late to actually engage the service, and we can go ahead and take an order and get you right on the schedule.
Because everybody has the same goal, to get you better and keep you out of the hospital.
Absolutely.
Thank you so much. Lynn Armiger with PRMC and Beverly White with Peninsula Home Care at Nanticoke. Thank you for being here this afternoon. Very important information.